Call meeting to order. Please stand for the Pledge of Allegiance. Good evening. Welcome to the July 7th session of your Brookings City Council. We're going to begin with two oaths of office, swearing in new council members. Constable Collins, would you join me down here, please? All right, we make it easy. You don't have to repeat anything. I'll do it, and then sounds good. I think we talked about it. So, you, Joey Collins, have been elected to the office of City Council member within and for the City of Brookings, Brookings County, South Dakota, do solemnly swear that you will support the Constitution of the United States and of this state, and the Brookings City Charter, and faithfully discharge the duties of your office, and that you're not under any direct or indirect obligation to appoint or elect any person to any office, position, or employment under the government of the City of Brookings. I do. Here's your oath of office. Thank you. Councilman Niemeyer. Hope Niemeyer, having been elected to the office of the City Council member within and for the City of Brookings, Brookings County, South Dakota, you solemnly swear that you will support the Constitution of the United States and of this state and the Brookings City Charter, and faithfully discharge the duties of your office, and that you're not under any direct or indirect obligation to appoint or elect any person to any office, position, or employment under the government of the City of Brookings. Thank you. Yep, there's your oath. All right. We can applaud. All right, this time I'd ask City Clerk to record council attendance.
Bacon.
Aye.
Brink.
Present.
Corbett.
Present.
Niemeyer. Present. Tiltonburn.
Present.
Wendell.
Present.
Collins.
Here we have a quorum. This time entertain a motion to approve the agenda.
So moved.
Second.
We have a motion and a second. Any public comment? Seeing none. Any council comment? Please call the roll.
Bacon.
Aye.
Brink.
Aye.
Corbett.
Aye.
Niemeyer.
Aye.
Tiltonburn.
Aye.
Wendell.
Aye.
Collins.
The agenda is approved. Next, under open forum, before we invite the public to come up and speak to any subject, I'll turn it over to the city manager and his team.
Thank you, Mayor, City Council members. Last week at Council, we were asked to update Council and the public on our marketing efforts, as well as enforcement of the current ordinance. Currently, we have a reactive enforcement of the ordinance that's currently in place. People call or they utilize the new Engage Brookings app, and staff generally responds fairly quickly. We have had only a handful of calls, and the resolution is generally fairly quick once staff addresses the issues at the various locations. Marketing to date includes understanding of COVID ordinances, best practices from wearing a mask to social distancing, and business opportunities for education. Chelsea, our public information officer, is here. We'll explain what we've done to date and what we'll be doing in the future. But we would also like to do much more, but we do have limited funds and professional staff and limited marketing staff. And that's why it's imperative that we work in harmony with our local community partners. Tonight, we also have the CVB, Chamber, EDC, the university, hospital, United Way, public schools, who work consistently with us to share our messages. And I'd like to report that moving forward, every week we will be meeting together to talk about those efforts and how we create a cohesive message moving forward, not only for our community, the students coming to town, but visitors as well. Tonight you'll hear from many of these partners, but first we'd like to start off with Chelsea, our public information officer, of our current efforts and future as well.
Good evening, council members and members of the public. Tonight I put together a presentation of some of the things that we have done to date since the COVID pandemic started. I'm just going to go over some of the ways that we've reached the public and some of the things that we're currently doing and will continue to do, as well as some things that we have coming up that we're putting together at this moment. One of our main ways that we reach the public is through our website. We have a COVID-19 tab, which is basically a COVID-19 informational website that we have put together that includes information on our ordinances, resources for the public, health and safety information, as well as other COVID-19 information. We have a press releases section, not only on our press release section of our website, but also in our COVID-19 tab that highlights COVID-19 related press releases. To date, we have released 27 press releases related to COVID-19. We also have a COVID-19 update that shows up on the left-hand side of our website. This is part of our emergency alerts system. This goes out through text and email to community members that have signed up to receive those. That also is updated every time one of our ordinances changes, and I also update that with information daily or every other day based on the community spread that we have in Brookings County. We also have a spotlight section that I have utilized to add information on reopenings, closures, and cancellations, as well as safety and preventative measure information and other information related to COVID-19. Next. Social media is the main means by which we are sending out information related to COVID-19. We have 4 different channels that we provide information on, and because of the quickly changing nature of COVID-19, it's one of the best ways to get information out to people quickly. This month alone, we have reached 45,681 people just on our Facebook platform. Our top performing educational posts related to masks reached 26,955 individuals and was shared over 200 times. Next. Another means by which we are reaching people is through our Engage Brookings app. We have emergency ordinance information that is on the app that people can see, and also they can submit questions and concerns via the COVID-19 section of Engage Brookings. They can download that on their phones, or they can access that online or through our social media presence. We have several different types of press releases and spotlights. I touched on those briefly, but I just wanted to also say that when we release those press releases, not only do they go out to the media, but they are also sent out by text alert to people that have opted in to receive them, as well as through our city email list, and as do our spotlights, and those are similar to our press releases. We have done several video collaborations to date. We have created 29 videos related to COVID-19 and also done video collaborations. We also share video content from national and local health agencies. Next. We've also created printable signage and information that is available to the public that they can get from our download on our COVID-19 tab. The Chamber of Commerce and other community organizations have also decided to share these on their pages as well as through their email lists. So these are something that community members and businesses, they can print those off and they can put them up on their businesses. And then also Paul has been wonderful and gone on the Brookings Radio. He has a radio show that he does, and he talks about COVID-19. And Mayor, I believe you have done that several times as well. So we are also reaching individuals by radio. Some of the current projects that we have in progress are continued safety and prevention education pieces. We are working together and meeting weekly for community partner collaborative efforts. And then one of the main projects that I am working on right now is a color-coded informational public, a public, I don't know what you call it, a set of guidelines that shows the risk and also shows which ordinance is currently in place. And you can see there, I have just a sample of what it will look like.
With that, Chelsea just gave a quick overview of the things that we're currently doing and what we're going to be doing. We do have some of our other partners here in the audience that we speak with on a weekly basis that would like to talk a little bit about what they're doing on their future endeavors and plans. And I'm very excited If we could maybe have Laura come up next with the CVB, then the Chamber, EDC, and of course SDSU as well.
Good evening, Council. Good evening, Mayor. Laura Shane Carbonneau, the Executive Director of Visit Brookings, our newly rebranded office, and very pleased to be here with you tonight to talk about something that actually one of you gave us the idea. So thank you, Councilman Wendell, for really leading us in the right direction. And what we're talking about doing and implementing in the next couple of weeks is something that we're calling the Brookings Stay Safe Pledge. This would apply both to our visitors, who is really who we usually work with. We know that people are looking at coming especially to South Dakota because it is deemed a very safe place to come, but we're also taking a look into the community itself, and that's where the Stay Safe comes as well, where we want our community and our residents and the students who will be coming in the very near future to stay safe in Brookings and have a continued safe community. So the plan that we're talking about is really has 3 phases. We're developing a toolkit, which is in development currently right now. Once that's ready to go, we're going to roll out our education piece, and that's really talking about what we're doing, why we're doing it, and simple instructions for ways people can be involved, which leads directly into the next phase, which is cooperation, where we ask businesses, residents, students, others to voluntarily, including visitors who come to our community, to voluntarily take the pledge to stay safe in Brookings. And it'll be very simple instructions based on recommendations that we get from the healthcare system, as well as some of the things that our businesses are currently implementing to just to cooperate and let people know that this is what we're doing to keep everyone safe. And then the third phase is commitment. And that's really not just taking the pledge, but making sure that you're following the pledge. So we think that by doing it voluntarily, we know that there are people in the community who understand what a serious situation this is. We know that people who are coming to the community want to know that they're coming to a community that's safe, but they also want to do their part in keeping the community safe as well. So that's just a very brief overview. If you have any questions, I'd be happy to answer those. But please stay tuned because you'll be beginning to see a lot more of that in the next week or 2. Yes.
I do have a question. How would prospective visitors to the community get access to that information initially?
Yep, a couple of different ways. We're going to start our communication in different phases. So we're going to start with our hotel properties, with our restaurants, with the bars, with the places that we feel like are going to be first and foremost catering to the students. This is kind of the impetus for what we're doing. But we're also going to start our marketing again, and we'll incorporate some of our marketing messages with a safe travel pledge as well. So people can click on our website and take it so they know what the expectations are. Further, we hope that once people do commit to taking the pledge, there's going to be a website or a page on our website where people can click the box, then they'll have access to flyers, to posters, to things that they can put physically in their business, in their windows, but also put social media messages, links to things that they can add to their website so people know that this is a safe business. So it's going to be a multi-phase event. We're going to be working with our partners, with the Chamber, and with others who are willing to share the message throughout the community as well.
Councilman Wendell?
I just had a comment. I wanted to say thank you to Laura and her team at Visit Brookings and Kelsey and her team at the Chamber. When I pitched this idea, they were really responsive, as was Paul and his staff here at the city. They researched best practices across the country, looked at other peer cities and considered how they were implementing similar programs. They really went into problem-solving mode, and I appreciated that, and I think it puts us in a better position to launch a program like this that will not just have good intentions, but be effective in the long run. So thank you very much for your responsiveness to the idea.
Okay. Thank you, Laura.
Thank you.
Got to say thank you, Chelsea, too, when you got up. But
Next, if we could have Mike Lockram from the SDSU present real quick. I will let council know that Julia from the hospital, their marketing person, couldn't attend tonight, but she did send me a laundry list that I'll give to you. We can upload to the website as well. It is interesting. They're going to be announcing a PSA coming forward actually today through the newspaper, and they're doing some radio ads on the importance of wearing masks for each other, as well as social distancing and other best practices that we can take as a community. So that'll be coming from the hospital. But Mike, if you would go ahead and give us an update on SDSU.
Thank you. Thank you, Mr. Mayor, members of the City Council. It's a pleasure to be here tonight. I'll break this down into a couple of things. One, I'll talk about what we have been doing, and then what we are doing as we move forward and look towards the fall with the return of students to campus. When the pandemic first hit, and obviously we went online, we had our COVID-19 response team that reacted very quickly to moving our entire operation online and also remotely. And there was a number of educational things that went into that, in addition to what that operational communication would look like. The educational pieces fell in line with the CDC guidance and other things that were coming out at that time. We spent an awful lot of time with that group, and as we moved towards the return of students on campus this fall, President Dunn initiated our Jacks Are Back task force, which is looking at the planning and what we are going to do in getting ready for that. And there's a number of plans that have started to develop, some of which are available on that website. We continue to push people to look there for the plans. There's a number of plans, including this week, that are going to be approved and made available here in a very short period of time. In that effort, we outlined our guiding principles. We talked a little bit about the timeline that was in there. And some of the communication that we did along that way was within our unpaid media opportunities. A lot of television interviews have been done to talk about the task force and what we're doing. Our leadership was on Dakota News Now a couple of weeks ago, basically the Friday morning show. So we've been able to get out there in those opportunities and show people what we're doing. President Dunn's also on a biweekly radio show with Perry Miller. And so we continue to utilize that opportunity as well to connect with the community. I mentioned some of the educational materials. We are working on some kits, some gift bags, hygiene bags that we will provide to our faculty, staff, and students when they all return. We did reopen campus to some degree in bringing staff back on June 1st, so there was a number of things that went into that communication and that education in terms of how to act appropriately on campus and what the expectations were as we brought people back into that office. This is a phased approach that we'll continue to do up until the first part of August when we get more and more people back on campus prior to the students being here. The gift bags will have educational material in there, a number of things in terms of the hygiene, the importance of the face mask. We've put printed posters throughout campus and in every residential hall room to showcase the importance of wearing face masks. So a lot of that continuous education continues to happen. The other thing that we're working on moving forward with our staff this month is we're doing a series of videos that's going to showcase campus and what that new environment will be like. So we just put together a draft of what the Wellness Center and how that operation will look for students when they come back. We have videos coming out for res halls, food services, classrooms, the university, student union, library, auxiliary services like the bookstore, things that students were used to coming in touch with. They're in a much different environment right now, and we need to show them what they can expect moving forward. From a marketing perspective, when we first went into the pandemic, we really needed to find a way to support our students, the community, our faculty and staff, and we launched the Here for SDSU campaign. And it was really just a lot of short video, a lot of quick marketing things to talk about the support that we were going to provide, in particular our students as they went into that online environment. Some of you may have seen what we transitioned into the Dear Tomorrow campaign, which highlighted our students, our research, our alumni, and then some other faculty members, really about kind of setting the tone and the importance that we need to continue to provide the educational experience, the research opportunities, all those things that go into being a land-grant university. We're now transitioning that into, we're kind of finalizing what it's going to look like, but it's going to be a campaign talking about how we need to care for each other. The importance that we all take the necessary steps because we're going to be in this together, and to do this, we need to rely on each other to care for ourselves and to care for each other. That campaign will get kicked off here in just a couple of weeks. We're starting to see some of the elements and some of the messaging that is going to go along with that. It is going to be students talking to students. It's going to be students talking to the community. It's going to be faculty talking to students. It's going to be our university leadership talking to those individuals as well. Really a powerful message that's going to drive home the importance of looking out for each other. Finally, in terms of other distributions, we've had a lot of questions and answer opportunities through our new student orientation. There's been a lot of communication that's gone out to students in particular to move in. We launched the Drop and Go program that allows students to bring their stuff to campus earlier, leave it in their res hall, and then return home. And then we'll encourage them to come back as late as possible prior to the start of the semester. That way we can spread out what's traditionally been a really big day and a fun day on our campus and just have to do it a little bit differently, but get those students here and get them acclimated to the university life and get them started off on the right foot. We continue to send things out through our social media, through email, through digital paid campaigns, through television. I mentioned the radio and some of the unpaid media opportunities. I don't have necessarily the statistics with us, but we have hundreds of thousands of followers on all of our different social media challenges, so these messages do get received, and we've had really good response with each one of those. With that, I'll probably pause there, and if there's any questions, I'm happy to answer.
Okay, thank you, Mike.
Thank you.
Al, I know that you had a quick handout that you'd like to go over as far as things that the EDC is doing in partnership with other entities as well. I will also note that Heidi with Unitedway did give us a handout with all the non-for-profit efforts as well that I'll upload to the website as well. That's another entity that we're communicating with.
Good evening, Mr. Mayor, members of the City Council. I'm Al Houghton, Director of Brookings Economic Development Corporation. Just going to say a few words very quickly about some things that BEDC has been doing since the beginning of the COVID outbreak. We have been monitoring that situation economically, so a lot of the information you will see on our website relates to how the community is doing and the county is doing in terms of its economic growth, job loss, those kinds of things. So there's a COVID-19 dashboard on our website. I'd encourage you to take a look at it if you haven't seen that. It's got a lot of good information on it. Also sharing information on that site for the business community, collaborating with pretty much everybody you've heard in the room so far and others, pushing out information, and we'll continue to do that. So one of the things that we have started pulling together over the last few weeks is what we're calling the Brookings Resiliency Collaborative. This is essentially a group of a lot of the organizations that are here tonight speaking or taking part in this, each one kind of heading up 7 different focus group discussion areas. So we have discussion areas around health and safety, jobs and employment, safe business practices, messaging, housing, food and security, economic opportunity, and then of course SDSU is a piece of this puzzle as well. So what we're trying to do is find out within each of those different areas or focus group segments of the community, what kinds of information do they need? What kind of challenges do they see from their perspective that we're going to face with this COVID-19 issue as things start to open back up? And then how can we address that as a community? So a lot of partners, I've got those listed out in here, a little bit of information, just some key takeaways from discussions from the meetings that we've had so far. And one thing I want to stress, and it relates very directly to the meeting tonight, is that in every one of our discussions, prevention is a key topic that comes up. That if we're going to remain open, we have to prevent this from getting any worse. And then messaging goes along with that, that we have to get messaging out to people continually, get them engaged in implementing safe practices, doing better at wearing masks, social distancing, and those kinds of things. So I'm not going to read through all those. Just one last thing that we're doing at BDC, the last page of this handout that I have, talks about some of the prevention messaging ideas that we're going to implement. So we're going to be working on some social media video shorts, looking at things that are maybe even just 5 to 10 seconds long, different people in the community that would be relaying a message that we hope would relate to different age groups and backgrounds in the community about why they think it's important, for Brookings people to practice those safety measures. So those will be coming out in a couple of weeks. We do have somebody we're working with to do that video work. There are some that we may produce in-house in addition to this list that will come out a little bit quicker. Looking at getting some yard signs made to get around town to reinforce the COVID safety messages. Just getting started on a conversation with the city on the light pole banners on 6th Street in downtown to see if there might be something that we could do with there to relay that message, which would also help with visitors coming to town. Some things like a selfie video contest. We'd like to get community members engaged in this process so that they're taking part in it and feeling like they're part of that solution. So there's some other ideas we're working on too. Some of that not ready to release yet would involve more contest related things. So as those get further developed, we'll roll those out. So happy to answer any questions you might have.
Any questions? Okay. Thank you, Al.
Okay, thank you.
And Kelsey, is there anything from the chamber you would like to update as well?
Good evening, Council. Kelsey Doom, President and CEO of the Brookings Area Chamber of Commerce. So in the past few months, your chamber's been working hard communicating between what the city's deciding to the business community. A lot of times our businesses can't tune in and watch the entire meeting, and so we're really creating some communication to help them digest the ordinances that are passed here and what impact that has on those businesses. We've also been doing business surveys, both business and consumer surveys. So getting you all the information that you need to come back and make decisions on the ordinances that we're passing, in addition to what businesses need to build that consumer confidence back up as we continue to reopen. We too have a website with some safe practices and toolkits with some signage and things like that to help businesses communicate what they're going through and what they need help with from their consumers. Moving forward, we're going to be working closely with Visit Brookings and BEDC on the Safe Business Practices sort of subcommittee of the Brookings Resiliency Collaborative. The big message that we're going to be sending is, regardless of whether or not you believe in what those really smart people at the CDC are recommending, if our cases go up, SDSU is going to have to take action, and that's going to impact our pocketbooks of everybody in Brookings. And so we all need to work together. Look to the professionals on what we should be doing, and continue so that we can let business owners make the decisions to keep their businesses open. So any questions? Okay, thank you.
Okay, thank you, Kelsey.
That's the end of the report, Mayor, council members. Just wanted to give you a quick update of some of the things that not only the city but our community partners are doing. I think it's critical that we continue to work together, and that's why this group will be meeting weekly and discussing the various opportunities that we're going to be moving forward with to market not only to our community, our visitors, students that will be coming here before too long, working in collaboration to share the message, doing all that we can to protect our people here within our city limits.
Okay, and I expect we'll probably get current updates often, so what we're doing, so that's great. Thank you. Okay, then under open forums, an opportunity, anybody who wants to speak to a topic that's not on the agenda for tonight.
Hello again, Bradley Walker, resident of Brookings. Approximately 2 weeks ago, I made a comment and had some questions regarding the EV charging station on the city social media site. Conversation went as follows. My first question was, how many charges will it take for taxpayers to get their money back for what you spent on this? And I believe that was on a Wednesday. On the following Friday, I had got no replies. Following Friday, I made another comment, 2 days, and still no reply to my question. I finally got a reply, I believe it was Monday, which is understandable because I think I made that on a Friday evening after everybody was gone home. Anyway, the reply I got from the City of Brookings government was the installation cost of the charger was $2,200, which was paid by the city. The city will use a rebate check of $3,000 to pay for the first year of the lease, which is approximately $2,800. The lease for year 2 and 3 lease payments will be split between the city and county. The city will continue to look for further energy grants and rebates as we move forward to offering the EV charging station. The charging station is an amenity for the community and further demonstrates the city's commitment to sustainability. As with other services and programs, the charging station follows a quality of life amenity model and is not designed for full cost recovery revenue. My reply to that was, what percentage of vehicles registered in Brookings County are electric powered? 10, 5, 2, less than 1? Was there a feasibility study done to determine this? I think there should have been. If you're marketing something, you do a feasibility to see if there's a need for the product. If so, how much did that cost the taxpayer money? Then I said, so what you are saying is you are adding an amenity that benefits a very small percentage of citizens while adding a burden on the taxpayers but you can't open the swimming pool, which has been fully funded in the city budget and it is an amenity all citizens are able to benefit from if they so choose. I fail to see how this is a commitment to sustainability. With budget revenue shortcomings because of COVID, I don't find that that's fiscally responsible as is set forth in your mission statement. Then I have couple other questions about that. Who decided for the placement of the station out here in the parking lot behind the building? Seems to me like it's kind of hidden from the public and not easily accessible. Why wasn't it put in, say, the 24-hour parking lot in downtown or over at Walmart Runnings Complex where many people have access to it and it's fully visible and people know where it is and can actually use it. And then my other question is, since it's been running for 2 weeks now, how many people have actually used the charging station? You have any idea if it's actually been used at all?
I don't have that idea.
I mean, does anybody know if it's actually being used?
I guess, do you want me to start answering your questions, or do you have more to go?
Oh, no, if you can answer them, go ahead.
Sure. Placement of the location of the charging station was done internally by staff, but also there's a joint powers board that meets every quarterly, and that's the difference between the county and the city. Together, we put it in the appropriate location. Had we located it further from that location, it's all strategic. The closer you can locate it to a power source, the more cheaper it is. So had we located in some of these other locations you're talking about, it would have driven up the cost. So at the end of the day, it's about dollars and cents, right? You talk about the pool, you talk about the cost of this. First of all, when we looked at initially doing this, we had a contract in place after the first of the year to get this installed. COVID hit around March. If you back out of the contract, you still owe the money, right? We did have a grant to help offset the cost initially. But when you compare it to the pool is at a loss of about $100,000 to $150,000 to $200,000 a year. Yes, our hope is to have people utilize this electric facility enough so it pays for itself. But initially, we have to get it and then start marketing it, and that's what we started to do, is market the service. The response was exactly right. It probably won't pay for itself initially, but the hope is over time. And it is a sustainability effort. Our Sustainability Commission talked about this as an opportunity to help educate people about the importance of the future, and that's potential electrified cars. How many there are in this community, this county, I couldn't tell you off the top of my head. I'm sure the DMV might have some of that information for you. My hope is that there's more. In fact, there's a MERS grant that's going to be coming out for people, I believe, to purchase cars and have that electrified system. Isn't there, Jake, some type of rebate that's going to be coming out? The DNR, yeah, there we go. So more to come on that. So our hope is that there's going to be more and more people that will be utilizing this. We hope to obtain a second one in the future and have it closer located to the interstate, because I think that is a great opportunity to pull people off the interstate. The intention of locating it down here was closer to downtown so that people can come in to town, charge their car in a public parking lot that's well lit. We also have cameras out here. They can then utilize the shopping of downtown restaurants and hopefully spend more money and maybe see a return adversely to our sales tax. That answer most of your questions?
Yeah.
Okay, wonderful.
Thank you.
Mr. Walker?
Yes.
I was the one that initiated this, and one of the ideas behind it was for sustainability and to show that we're a community that was committed to that. The other thing is, too, is it's a possible invitation for anybody that needs to charge their electric car on the way. And some of these cars only get 45 miles. For example, the car that was there the night that we had the ribbon cutting, it doesn't do but more than 45 miles on a charge. So it's basically a local vehicle. The other thing is some of these other vehicles, there might be charging stations in Sioux Falls, but I don't know if there's one in Watertown. So there is a certain distance that they can make it. So if they don't quite make it to the next destination that they're planning on, all they've got to do is get on an app to find that there's one here. And it takes about an hour to hour and a half to charge it, enough time for them to go down and enjoy our downtown. And that was part of it also, is to invite people to our community. And if we get somebody that wants to move here to be part of our community, so it's a benefit to all of us.
Yeah, okay, that's kind of like, so when you buy an electric vehicle, you have to install a charger in your home to charge it. So that's be like saying, I don't know if anybody would really expect to buy a vehicle and expect to if it only had a 45-mile limit on a charge?
Well, some of them do. Some of them have
Right,
more than
I'm
that.
sure that some of them,
So, I mean, if somebody's doing a long distance travel and they have to look and plan as to where they're gonna
exactly.
charge up, and so this is one of the options.
Yeah, I mean, if you're gonna drive to Sioux Falls, you're not gonna leave here with a quarter tank of gas.
Correct.
Knowing you're gonna run out. You're gonna
Correct.
be fully charged, and you're not gonna go further than your,
But if you're going from Kansas City and you've only got so many different charging spots to get up to Fargo, this might be one of the stops.
right, if there
Okay.
is some available.
That's what I'm saying.
Right, but again, if you look at it that way, coming all the way, if that was your plan, why not put it closer to the interstate? I mean, I get it where you want people to come and hit the local businesses while they're waiting for their cars to be charged, but still, to me, it seems like with all of these constraints on your budget revenue now, that it doesn't seem to me to be something that's worth investing in unless the city is going to plan on purchasing electric vehicles, which might be a good idea, in the future, and start using that source for the city.
Well, and the thing is this was something that was initiated 2 years ago. This wasn't like we just decided to do this yesterday. And we were building this parking lot on the north side here, or on the south side, and it seemed like the right place to put it. And we can argue about this all night, but,
I'm not arguing, I'm just trying to make a
well,
point.
okay, we can debate it, we can
But I
discuss it.
tried to look up on the sustainability plan, and I didn't see anything on there regarding any electric charging station. I might have missed it, maybe I didn't miss it, but I reviewed the plan, and I kind of saw in the budget where the pool was fully funded for $117,000 a year, fully budgeted. Now, where that money's going now, since the pool is not being utilized, I have no idea. That's up to you guys to figure out. Thank you.
Okay. Anyone else? Yeah, I'll close the open forum. This time calling city manager for number 6A.
Good evening, Mayor, City Council members. The current ordinance 20-007 is set to expire July 13th. The ordinance impacts restaurants, bars, gyms, salons, grocery stores, and other similar businesses. Major components include the regulation of 50% occupancy for some businesses, food services, including bars, salon employees have to wear masks, and grocery stores do have to provide separation. There are other requirements outlined within the ordinance, but those are some of the major components. It does appear that between last week and this week, there has been confusion by the public, and just want to clarify that the ordinance before council tonight does not require the public to wear masks, but we do strongly encourage the public to wear masks for each other and for the rest of the community. But once again, just want to clarify, this ordinance does not require the public to wear masks, only those employees outlined within the ordinance. Last week, council held the first reading of the ordinance, continuing the existing regulation for bar, and included specific language for bar employees. In June, when council began revisiting this ordinance, Brookings had 24 COVID cases with 1,113 tests. Today, Brookings has 83 confirmed cases with 58 recovered and 1,849 tested. The item before council tonight, I'm sorry, that was negative. The item before council tonight would continue the existing regulation until early September if approved. Council does have a few options. You can approve the regulation, and the legislation will go into effect for 60 days, once again, until early September. Council can make minor changes to legislation, and once again, very minor changes, and it would go into effect immediately. Council can approve an amendment with major changes. However, a second reading would probably have to be heard. Once again, we'd have to hear what some of those changes might be. And council could do nothing, and the current regulation 20-007 will stay into effect and cease to exist July 13th.
Okay, thank you. Council at this time entertain a motion to approve.
So moved.
Second.
Okay, we have a motion and a second. Open to public comment on this time for this ordinance.
Thank you, Mayor, Council, City Manager, J.L. Thorpe. I just have two questions, and hopefully with the first one, maybe that will clear up the second question. My first question is to the council. Do you as a council have objective standards that have been triggered? through this action tonight, or are you kind of making this up as you go? It's been 4 months now, and I guess I'm just not exactly tracking where in your policy rationalizes the decision to not relax restrictions. So yeah, I guess I'm just wondering, do you have objective standards that have been triggered at this time?
I can take a swing at that one.
Councilman Whittle?
Sure. Well, as an individual who made the amendment to extend the existing ordinance for an additional 60 days, I would say that when we put Ordinance 20007 in place, it was to mitigate the spread of COVID-19 in our community. We understood at the time that practicing social distancing and wearing face masks, in particular in indoor businesses, was a key way to do that. We've had that in place for several weeks, and in fact, a couple of months, as you referenced. And as it came time to think about lifting those restrictions, it was clear that COVID-19 was still present in our community, and in fact, our confirmed case count was increasing. We know more today than we knew in March about COVID-19. I think while there is some debate in social media, there's some debate in the media, I think in the medical community, we know that social distancing and wearing masks limits the spread of COVID-19. And as a community that hosts our state's largest public university, we're just weeks away from welcoming students and families back to Brookings. And when I think about students and families throughout the state of South Dakota trying to determine whether or not it's safe to send their student back to Brookings to either re-enroll or enroll for the first time in our university, I want to ensure that we do everything we can right now to reassure folks in this state and this region that Brookings is a safe place to live and to visit and to attend a university. And so when it came time to consider whether or not we would lift this ordinance, to me, now seemed like the exact worst time to lift this ordinance. Instead, I think it's important that we reinforce practices that we know have worked. When we look at peer communities throughout the state, they have seen many more cases, and I'd like to think the work we did in March and April and May and June have had something to do with why we have had relatively low number of cases. We are seeing those case counts increase as folks lift some of their own practices, and I think as a community, we have to reinforce those restrictions, and that's why I made this amendment.
Okay, thank you, Nick. So just to clarify, there are no objective standards in place. You have nothing in place as a council that states based on X number of cases, based on X number of hospitalizations, deaths. There is no standards in place. Is that correct?
Well, I'd invite you not to put words in my mouth. I did not say that there were not objective standards. We rely on guidance from our State Department of Health, from the Centers for Disease Control, from the National Institute of Health, all of them reinforcing these restrictions. States that have prematurely lifted these restrictions are now reimposing them. I understand that folks are concerned about our economic ramifications, but if you're pro-economy, you should be pro these restrictions so that we can shorten the length of time that they have to be in place. I think we'd all like to go back to normal, but that's not viable. So to say that we don't have objective standards, I think is unfair. We are all following guidance from state and national leaders. The messaging has been mixed, and it's fallen to local leaders to make local decisions. And I believe that these restrictions are crucial to control the spread of COVID-19 in our community, and that has almost universally been reinforced by the medical community.
Okay, so my follow-up question that I do believe that the community deserves to hear the names of who is advising you as a council, and I'd welcome anyone else to answer that too, is that I understand that there are many recommendations by the CDC nationally, but the last time that I recall seeing a public presentation at a city council meeting with recommendations was in March. Obviously, that's eons ago in the world of a pandemic. I would just like to know who it is exactly that is advising you to create these actions.
City Manager?
Yeah, I can sure answer a lot of that. What we do is we have professionals from the hospital, the Avera, as well as Sanford, as well as the university. Those individuals were part of a forum here just about a month and a half ago. All that information that we had at that point in time was shared with the public. They continue to meet with the council members 3-on-1 every few weeks to hear what's going on here locally, understand what's going on nationally, regionally, but also understand from their medical professional advice how we should proceed. That information is given to the council. Council then utilizes that to make their decisions.
All right, thank you, Paul. I guess the last question is, amongst the experts that you have consulted, is who have you consulted in terms of the curve of the economic impact? I think that that is obviously a factor. I mean, it is a factor here. So in addition to consulting with local experts, who have you been consulting with in terms of economic impact?
Sure, I can respond to that one too. We've utilized SDSU, which we greatly appreciate, to understand the macroeconomics, not only national but regionally. We also talked to our economic development director to understand more regional and locally, and then of course our CFO to understand more at that micro level. And so those individuals have also spoken with the council members on a 1 and 3 discussions. In fact, later this week, I'll be having similar discussions with them again. So we tried to weigh not only the health concerns, but also the economic concerns, and try to give as much of that information to council so they can make their decisions.
Yes, thank you. And I would appreciate if that information could be made public as well. I don't think there's been really a council public discussion about the economics. I guess at the end of the day, I mean, I'm not going to stand up here and argue with you guys about what the best approach is. I do believe, though, that without any form of standard plan for how this is going, I mean, we've had 4 months. So to me, for there to be no threshold of any of those statistics and to be making the decisions based on emotion, I disagree with. And I also just want to know, as a member of the business community, is this how this will be handled every time there is an outbreak? Because business owners need to know if they should renew their leases. Because if this happens again a year from now, that's not sustainable. And so I just think that it needs to be communicated to the business community, which drives the economy of our city. Is this how it will be handled moving forward? Thank you.
And I could just add a little bit more light into that final question. Chelsea, as she presented, her last slide was a picture of 4 phases that we're working on. It's based on our current ordinances that we have in place that we can take advantage of at any point in time should we have more cases. The problem is trying to determine that threshold that moves us between the various phases. What's been difficult is we've relied on our local professionals in the medical perspective, but with the added testing that we've had here most recently, that threw a wrench into everything. Because before we were thinking we could utilize as a positive percentage of the overall cases, but because we artificially increased the overall testing, that wasn't a possibility. So we're actually visiting with the hospital and others to try to come up with that threshold. So it's a great idea. We're working on it. It's only been 4 months, and all this is new to everyone. And we're trying to come up with the best measures possible. And my assumption is those will change in the future. But we'll try to be as transparent as we can once we have those developed.
Can I make 2 other notes in response to those questions? I would also want to highlight that we have consistently heard from Dr. Bonnie Spector, who is an epidemiologist with South Dakota State University. She's provided a tremendous amount of data, and those slides were made publicly available today. She has continued to update that information. It's got worldwide, national, state level, and local level data that really has tracked this epidemic from the beginning. It's really valuable information, and it's guided a lot of the conversations we've had. And again, those slides were shared publicly today. The other note I would make is we think about some of the thresholds that are in place. The Centers for Disease Control has said that cities and states should hold off on reopening until they have seen declining case numbers in their community for 14 days. We've not experienced any stretch of 14 days where we've seen declining case numbers. And so I understand that a lot of communities have disregarded that guidance, but it's been very clear, and it's a number that's circled in red, and we're not there. In fact, we're moving in the other direction.
President Dunn?
Mr. Mayor and members of the council, thank you for your leadership and providing us the opportunity to participate in this discussion. First, I want to congratulate you on the decisions you've made throughout this pandemic and the emergencies that was associated with it. I think you've taken the right approach, and I think the results are proof that you've made wise decisions and continue to make wise decisions. While we do have community spread, which was what Councilmember Wendell was just talking about, and we are not in a declining state of cases in Brookings, I think we have kept it pretty well under control with the measures that you took and the measures that we took at SDSU. So I think the greatest evidence that we should use that you've made the right decision is the evidence of the number of cases that remain modest. We have not overstressed the Brookings Health System, which I think you deserve a lot of credit for making wise decisions. So I want to thank you on behalf of the students, faculty, and staff of SDSU for making a good decision. On behalf of SDSU, I support the decision that you're considering tonight. I think it's the wise thing to do. I think, as was mentioned, we have to send a message to students and their parents that this is a safe place to come. We have a few weeks to do that, and this is a great message that Brookings cares about their future. The worst thing that could happen to this community, in my opinion, is if we reopen, which we're going to do August 19th, and then we have to close again. It would be devastating to the university. It would be devastating to the Brookings business community and devastating to Brookings. I think we would lose enrollment for years to come. We would lose trust. There are options for young people to go other places to finish their degrees or to start their degrees. University of Minnesota, Mankato has a very strict mask policy. They're working very closely with Mankato. That's just a couple hours away, and a student could take their 60 credits and go somewhere else and finish a degree in a community that is applying safer or applying a safe community for their students or their young people to live in. So I think you made the right decision in the past. I support the decision you're considering right now, and I want to compliment you on your leadership. I stand by for questions. Thank you very much.
President Dunn. Thank you, President Dunn. Anyone else care to speak to this ordinance?
The whole intent is to flatten the curve, or that's what it was early on. So my question is, can we find out like what the Brookings Hospital is, utilization? Is there any way, and maybe that it's out there and I don't know about it? I watch the South Dakota Health Department every day. I manage, I look at that. But I was just wondering if there's a way we can see Brookings utilization.
For clarification, when you say Brookings Health System, you mean how many
Yeah.
people are admitted or tested?
I know that three have been hospitalized,
Total,
is my understanding. Yes. Are they still in the hospital? I don't know. I was just wondering if, the community could know what Brookings Hospital's utilization is. I think that's important to know.
I think that's a question we can ask the health system. We can ask them that question about, they make it available.
Does anybody post it online?
I've not, this information is really challenging to receive, and I've said before that when I talk to the health department in Pierre and ask, because I'm asked, when we see there's numbers in Brookings, and then I get calls from the mayor of Aurora or White saying, is that our town or in the city of Brookings? And we don't know. And that's what really gets to be challenging, trying to figure out and help these other communities. So that's, a lot of good discussion tonight about comments and things we need to keep working on.
I think it'd be good for us to know in this area.
Yeah, okay.
I think maybe a finer point to put on Ms. Anderson's question also would be, and I know we've had these conversations, and some of it has been shared publicly, but probably not easily accessible. The number of beds available in our hospital and number of ventilators available through the Brookings Health System, I think, is the type of information that maybe folks are seeing shared in other communities. And if it were accessible here, it might be context that folks are really looking for. And so I think number of beds, ICU beds, ventilators are the types of conversations we're seeing in other communities, and could be helpful just to have a fully formed conversation here.
Any other public comment?
Hi, Bill Alsacher, 306 11th Street, Brookings. I support the resolution you're going to pass tonight, but I thought I'd just take this chance to ask a couple questions. So the spread, it sounds like we are calling it community spread. Is there any information available on where these cases have come from? Are we just going to expect we won't know, like if it comes from a certain bar or a certain business? Will we find that out?
That's one of the questions I've asked, and I'm not getting the information.
What I can tell you is that information is held by the state. The state doesn't share that with the city. However, on that South Dakota Health Department website, if there is a major outbreak, they do produce reports, and it's located on the left-hand side of where you get all that table information. So if you look on there, for example, I believe there was one most recently in Vermilion at a bar where an employee had COVID. They had to make a report. All that was found on that website. So if it's to that degree, the state will develop a report. But the specifics, individuals, businesses, that's not given to the city. And we've requested that of the governor and of the Department of Health, and they won't convey that to us.
Seems like that would be helpful in making decisions. If I'm gonna ask a question that stirs the pot a little bit, I guess. So like the bars are open, looking at worrying about community spread, would you recommend people go to the bars?
I'm not going to touch that one because it's a personal choice, I feel.
Well, you do worry about it spreading to other people, of course. I was just wondering if you think it's a good idea. So would you say, yes, please go support the bars, or would you say, if you're worried about it spreading, we shouldn't do that?
I think it's a personal choice.
I would note that out there, I believe it's CDC, or also I just saw most recently University of Nebraska Med Center listed an infographic of different activities that a person can do and the level of risk 1 through 10. And so all that information is available out there.
And I believe bars are very high risk. They're on the high risk end on that, I believe.
I couldn't tell you. I just saw it briefly yesterday.
No one's willing to go any farther on that, huh? All right, thank you.
Thanks, Bill. Anyone else care to speak to this?
Hi there, my name is Elizabeth Waka. I wanted to piggyback on a couple of things. President Dunn, I want to thank you for your advocacy at SDSU, and I have a great deal of respect for you, and I consider you a friend, so thank you. Nick, I would like to say that I appreciate your perspective and your willingness to give the rationale behind your decision to recommend extending restrictions. I absolutely agree that we must be cognizant of our SDSU student population, as well as all the employees and the economic impact that it does have on our city. So I do appreciate your rationale there. I am a white person, and I appreciate you being honest about that. So the first time that I spoke, I did ask for the names of the healthcare professionals and for the names of them, because I really wanted the opportunity to educate myself in the same manner in which they are educating you, because that's my civic responsibility, is to make sure that I am as educated and informed as I can. That will influence my decisions and how I respond to my civic responsibilities. We did not receive that information, and so I guess I'm just piggybacking on what JL said, that we would really appreciate that. That serves to offer the public an opportunity to educate themselves, but it also validates your perspectives and your decisions. I'd like to visit with them, and I guess my question is, can you appreciate that without these names, your decisions might be deemed arbitrary, and that could really foment resentment in the public, and we definitely don't want to do that. Can you understand that that may be a potential negative outcome? So if I need to meet with someone or meet with Paul, get that list of names, I can post it on Facebook, or I can do an op-ed in the paper, because I just feel like there are so many of us that want to be responsibly in a civic manner. That would help us do that. That would also help create a good, positive working relationship with you guys. I'd like to welcome you back to City Council, and I thank you for your experience and your work on the council. Joey, I don't know where you are. I can't. Oh, there you are. I should just read the new name tag. I welcome you to the City Council and look forward to fresh eyes and the perspectives that you will offer. And with that, I begin. As many of you are aware, City Council intervention regarding COVID preventative safety measures began around March 23rd, 2020. Since that time, 3.5 months, give or take, have elapsed, during which time citizens, business owners, students, employees, etc., employers have lived in constant fear and trepidation, suffering the anxiety of uncertainty, their lives having been turned upside down. Unfortunately, many of my fellow citizens have expressed frustration and disappointment because they do not feel that they have been heard or respected. I have been told that several people feel that their decisions have already, our assumption, and I do feel this way too, that we feel like the decision was already made before the city council meeting even occurred. I can't say whether that's true, but that was just my impression, their impression as well. Many of us have gotten the impression that public comment segment is, unfortunately, public comment segment of city council meetings has merely been a pretense and an artifice designed to provide you with a sense of having done your duty. We all want to have a sense of having done our duty, but we feel irrelevant. We feel like we're not being heard. When questions aren't answered, that just causes us to question, this relationship that you have with the public. And so all of these things have occurred, and yet despite the burden of fear, anxiety, depression, financial strain, etc., we, the citizens of Brookings, have, with exception of the few, complied with ordinances set forth thus far. This fact having been elucidated by Brookings' current COVID statistics. Given that we, the citizens of Brookings, have acted with civic responsibility in mind and have complied with these ordinances, I ask you this: isn't it time to show your respect for the civic integrity of the Brookings of citizens and our acknowledgement of the adherence to these ordinances? Isn't it time to return authority to business owners, the citizens of Brookings, employers, and students? Isn't it incumbent upon you to acknowledge and act on citizen compliance and statistical information? Don't citizen employees, students, business owners, etc. in Brookings deserve to have their dignity and self-respect returned to them, and the possibility of financial well-being returned to them by lifting restrictions and allowing them to implement their own CDC safety protocols? I've posed these questions to you because, having been in positions of leadership past and present, I have accepted that the most difficult aspect of my leadership responsibility is knowing when I need to relinquish authority and permit self-governance. I choose to believe that you will give all due consideration to how you view your leadership responsibilities and examine whether the decisions that you will be making soon are appropriate at this point in time. It is my assertion that this is the only appropriate and respectable course of action, and I thank you for your time.
Thank you. Anyone else care to speak? Okay. Dr. Meyer?
Good evening. I'm Dr. David Meyer, and first I want to congratulate our new councilman. I want to thank you all for serving. I want to thank you for studying this challenging topic and making the difficult decisions, and best of luck. I am a different kind of health provider. I work face-to-face with patients each day, so I understand this disease transmission very well, I believe, and it is all about the masks. Now, I can give you a lot of science, but I'm not going to, because you've studied that well. You have expert opinions from epidemiologists and other physicians, and I know you've taken that to heart. Not everyone believes the science, but I do. So I'm going to move on to another reason why I urge you to vote for this ordinance with the amendment with the mask. Not just the science, but it has to do with respect. Respect for our community, respect for our fellow citizens, respect for our children, and respect for our visitors coming in the fall, as President Dunn mentioned, who want to come and study and learn in a safe environment. So whether your political stance or your science stance doesn't fall in line with mine or somebody else, it's about caring for others and looking out for their well-being. So I urge you to continue this and leave you with a quote that I heard the other day: good public health policy will lead to good, healthy economic environment in the long run. So thank you for your time, and be well and be kind.
Okay. Thank you, Dr. Meyer. Anyone else? We've got time for about one more. I hate to be time-oriented, but the Planning and Zoning Commission has this room at 7:30. That's why come on up. Introduce yourself, please.
My name is Angie Rittershouse, and I'm just a citizen. I honestly really don't have a dog in this fight. I just felt that I consider myself part of the silent majority, and that we needed to give a voice and speak up for those. I personally do. I have a mask. I choose not to wear it because this cloth mask I don't feel is going to protect me from the coronavirus. I know you talk about the science, and I agree. There's science behind that, but it's a N95, you know, a respirator mask. Does anybody have one of those in here? Okay, you have one. Is anybody wearing it? No. That's what would truly protect you. So this to me is just a sign of submission. I believe we're missing the common sense factor in health and hygiene. Now, I use the hand sanitizer. I'm not going and hugging and kissing. I get the social distancing, but to me, this mask it's a call to, it's a dividing factor that I'm seeing. It's, you're going to submit to your guys' rules. Now, and I asked on the way in here, is it mandatory or recommended? Because I get that you're advertising and doing all this big campaign about it, and that the mask is so important, and big, bold, wear a mask. Like that, like I'm being told I have to wear it. Come to find out, but I have to ask, is it mandatory? Okay, mandatory because I'm a rule follower. Just like the rest of the majority, we're rule followers. We're gonna do what you say. You know what, I'm not gonna get in trouble, I will follow the rules, but it's recommended, it's a recommendation. If I felt it truly was gonna protect me, then I'd be all for it. But you wanna talk about economic, financial hardships and things like that, I feel for the businesses, I do. Because I personally, I am not going downtown. I will not, and I'm not talking about to the bars. I don't go to the bars, I don't care about that. I'm talking about going out to eat. Being served by somebody wearing a mask is not normal. It's weird. I'm not gonna accept that this is a new normal, because my question to you is, where's the line? Where's it gonna stop? It's going to come, kids are gonna come back. We know there's community spread. Of course there's gonna be. You know, I also believe there's such a thing as called herd immunity, that we're gonna get it. When you look at, yes, there is more cases, but because there's more testing now, because people are getting out. Is it more severe? No, our hospitals are not overwhelmed. The kids, they're not even getting it. So the whole pool being closed, I don't understand. But you know what? Again, I don't have kids that's going to affect. I'm not a business owner. I am just a citizen, speaking up for a lot of people that I've had this discussion with. And it's like, the flu season's gonna come? Did we shut down because the flu is bad? Now what happens when fall comes? Yep, you know what? Then we got the flu, we got everything else. And now we have more. And I'm not even gonna go about all the cases that were labeled COVID, but they actually weren't, just so numbers can get increased and it fits whatever agenda is going on. So my feeling, and I'd like to know, are the restrictions ever going to be lessened, or this is what we have come to? My question, because the numbers don't support this level of restrictions. I was in Sioux Falls, and they don't have restaurant staff and everybody wear masks. And you know what? I'll go out to eat there and I'll spend my money. The stores that are mandatory requiring a mask, they don't need my money then. I'm not going to do it. You know, it's why not give back to the community a little bit of common sense? We're all adults. You know, I want to make the best choice for my family and everything else, that I feel this right here, and it says faith over fear, that this just promotes a fear factor that I don't believe is rational for us. So, yes. My question is, do you foresee you're ever going to lessen the restrictions? Because I know you're already going to pass the thing tonight.
I guess I can respond to what I think was the final question about whether or not we'll ever lift the restrictions that are in Ordinance 20-007.
Yeah, like let more the businesses open up a little bit more.
Right.
You know, I mean 50% or 10 max or whatever, you know. And I haven't even started on the churches. And you know, because again, churches, we're rule followers. You know, we're gonna do the social distancing and everything. Right. We're not New York. We're not California. When it gets scary and things start happening, I mean, California they just outlawed singing in church. It's like there has to be a limit. And so far it was supposed to slow the spread. You know, okay, it slowed. Nobody's overwhelmed. Of course, there's going to be community spread at some point. The flu gets spread. The seriousness of this disease, it's a bad case of the flu unless you're really, really old. And granted, our healthcare professionals are very smart, and they're not going to put sick people in with the nursing homes. You know, we have that. Our state was one of the few to not have a lockdown, but not in Brookings. You know, Brookings, we did. So I'm just.
So I do want to answer your question, because I think too often I have maybe been remiss in responding directly to questions to avoid having a back and forth when I don't have answers, because I believe none of us really have firm answers. So when you ask a question about when will these restrictions be lifted or if they will be lifted, I can tell you I think all of us are trying to be guided by science and the facts that are being shared with us. None of us are imposing these ordinances assuming they'll be here in perpetuity. We've scaled them back a bit from where they were in March. We've allowed 50% capacity in bars and restaurants. We've asked for staff to continue wearing masks because the science is pretty conclusive that does limit the spread of COVID-19. I'd like to see us lift these restrictions over time, but I can tell you that if more people in our community don't wear masks, the restrictions will be in place longer.
Can I just make one point then about the mask? Because I see that this is really a big deal. Every time in the healthcare professional in here, correct me if I'm wrong, but masks really are for the sick to not spread. Healthy people should not have to wear it. That when you touch everything, and every time you touch your mask, and I know it might be too big or something, but I see you touch your mask all the time, that you've now just kind of taken away that protective factor. It's now contaminated. So where does it, and I'm sorry, Jared, not to put you on the spot, but you're also not wearing it correctly either. You have it below your nose. You know, that a not correctly worn mask is not going to help or do anything either. And so it's like a Band-Aid or just something to make you like feel better that you're doing something to be safer. I'm confused on that.
But we may just have to agree to disagree on this particular point. The one point I would want to make, because I do think we have a responsibility of something shared in a public comment forum to correct some misconceptions. One of the riskiest things about COVID-19 is that asymptomatic carriers can spread the virus very easily. So although you may feel that you're healthy and maybe you'll never exhibit symptoms, you still can very easily spread the virus. So I wear the mask to try to mitigate spreading the virus just in case I have it and don't know it. And so for those listening at home, and I know now there are a number of you listening at home throughout these meetings, I think that's an important point to make about the masks.
And I just want to leave with one final thought, is that I know it's been put out there that if those that don't wear a mask don't care, that cannot be further from the truth at all. I do care, and I love very much, but I'll just pray about it and have my faith that you guys will make the right decisions moving forward.
Okay,
In
thank you.
September.
Okay, we're going to close the public comment at this time. Council members' comments or questions? Councilman Brink?
Thank you to the public for coming tonight, and for all of you leaders in our community who have been coming together in the Brookings Resiliency Project concept, and for all of your comments here tonight. I think one thing that's really important when we are faced with a situation where we know people are going to have different opinions and going to potentially disagree is that we assume good intentions and assume the best intentions amongst everybody who's thinking about this. I think we can agree on the goals. I think we don't want this virus to spread in our community. We don't want SDSU to be impacted. We don't want to further have to shut down the community. What I'm disagreeing with are the methods that we're going about doing that. And I wanted to share a little bit about why. I've spoken before on this issue, but it's important for the public to understand why we vote the way we will. And I feel that our ordinance that we have, that we're going to be voting on tonight, is a challenge for a variety of reasons. For one thing, it puts the entire understanding and then compliance and implementation of it firmly on the backs of the business community. Individuals aren't tasked with anything. No other organizations are tasked with anything. It's really businesses to come up with a way to kind of comply here. It's a challenge to enforce, and we've been honest about that the whole way through. We don't have arms of people that can be going around to every business, checking them 4 times a day and making sure they're in compliance. We know that that's not happening, right? We also know that Brookings has a small footprint, relative speaking, to the size of the state of South Dakota, and in here we can make rules about this one little piece of land. We're not making rules about all of the other people that might be coming into our community or leaving our community or traveling somewhere or coming back in here somewhere. And some people do think that requiring these types of things is somewhat of a government overreach. I just think for all of those reasons that this is not the most effective way for us to accomplish our goal. I think that what I heard earlier in the meeting tonight about this marketing campaign, this public education, encouraging people and motivating them to do the right thing for the right reasons, asking for them to comply rather than telling them that they have to comply, I think is a better strategy to motivate people, to motivate human beings. And let's think about our SDSU population and younger people in general. We all know that we have laws on the books about speeding or about underage drinking or things like that, but you know what? It does happen a lot anyway, despite that law. So we have to think about is passing more laws like this actually going to be effective from the enforcement standpoint? And I would also just mention that these same regulations have been in effect this entire last 6 weeks or 8 weeks or so, when we have seen our cases start to rise. So for all of those reasons, I will be voting no on this, and I just wanted to explain myself.
Okay, thank you. Councilman Niemeyer? No.
Myself. First time listening and I'm reading the emails. I do feel bad for everyone in Brookings who is struggling. The virus has been around for a while, and I'm afraid it's going to continue for a while yet. As you all know, the economic impact on Brookings touches everyone in some way or another. I worry how long it will take business owners in the city to recover from this. I was shopping yesterday, I was looking around Brookings, and I noticed more people not wearing their masks than were wearing their masks. I saw a business in town where not even one employee was wearing a mask at all, and there was maybe 2 or 3 people in the store, and it was a bigger store, that were not wearing masks. So what do we do? I guess I don't know. Do we punish the businesses and people for not wearing the mask? How the enforcement go? I hope we don't ask our police to enforce this because they already are busy enough. I would like the city council to discuss what needs to be done in that area anyways. While considering which way I will vote tonight, I looked at how many people are actually in the hospital. We've had 3 at one point or another. I don't know what the time frame of that was. We're testing more people, so the numbers are going to rise. I'd like to think people are taking care of themselves and making their own decisions. One email I read today from a business owner and asked, what would we do, the city council, if our own personal income was cut by 50%, like some of the business owners here have in town? I know that this COVID has really affected my personal income as my wife runs a daycare, and we shut down for about 2 months. And that was about 50% of our income or so. So we were able to reopen again and start back on track. But I couldn't imagine some of you people in here that are still doing the 50% thing and what you're having to go through. I just wanted you to know my thoughts are on the vote, and I'll also be voting no tonight as well.
Now, Councilman Niemeyer.
Letting someone walk across the street before proceeding with your vehicle. Getting in the left lane when passing a vehicle with their flashing lights on. No smoking except in designated areas to cut down on secondhand smoke to protect others. Having liability insurance on your vehicle for your own financial security and the other driver and passengers. No texting while driving, just now enacted. These are all laws or common courtesies, to name a few, to protect all of us. Some of them are looked upon as overbearing, but we, for the most part, abide by them. I'm not telling anyone to wear a mask as a requirement, but I'm asking you as a courtesy to protect others. Common decency, people. You may think it's your constitutional right to do what you want. That's true. But if you unknowingly are spreading the virus, when a mask could have significantly lessened the percentage of spread, then does that give you the right to make other people sick? We had a protest march a month ago. There had been no reports of COVID-19 spread from that event, and would have been announced if there were. I and Patty attended the event and concur at least 9 out of 10 were wearing masks. Social distancing was not possible with the amount of people attending. Perfect example of the right thing to do. Business, for the most part, seemed to be adjusting to our situation. My business has adjusted itself. And yes, I'm one of the 50% incomes. I can't tell you how this has changed how I've done things and how it's been a burden upon our business. It's slowed things down. Supplies aren't getting there like they should be. We've got canceled orders. We've got projects that have been pushed back. Now we've got a bunch of them all top of each other because all of a sudden we've got transportation again. It has been very much a struggle. My business is adjusted. We wear masks. We're required when needed and when needed. I'm claustrophobic, and when entering our large retail businesses and those who have small square footage, I wear a mask. My glasses fog up continuously, and I rip it off my face as soon as I'm walking out of that business, just so I can get into the fresh air again. Do I like doing it? No, but it's the right thing to do. Tonight I will be voting for this ordinance to continue what we're doing, and hopefully in the future we'll figure out how to get through this. This has been quite a time for our economy. The local citizens now are the only patrons we have. If we do not keep this under control, we will not see students this fall. That will certainly affect our economy much more than what it is now. I have been frustrated through to make decisions for shifting information and not knowing the circumstances of those who have been inflicted with the virus in our community. We have no idea the circumstances of any of our victims that have gotten the virus. We don't know how to approach it. This is all we've got is the information that we've been given. Because of privacy laws, we have no idea where it's coming from and how people are getting it. All we know is they're getting it from passing it from another person, but we don't know where it's coming from. That is probably the most frustrating part for me on this whole situation. Anyway, this seems to be the best solution for now. I don't have any other good answer. And yes, there were good questions tonight and not good answers to them. But this seems to be the best thing that we can do with the proposed ordinance that we have. Thank you.
Any other councilman? Councilman Wendell?
Thank you, Mayor Corbett. I do understand the COVID-19 fatigue and frustration we're all feeling. I also understand the economic anxiety and the very real damage this pandemic has done in our community. But lifting restrictions and pretending the threat of this virus is gone won't help us return to normalcy any sooner. We've got more work to do to keep our communities safe. We've got to continue to practice social distancing, especially in indoor environments. We have to continue to wear masks, especially when social distancing isn't possible. Brookings is home to our state's largest public university, and not only is South Dakota State University an essential thread in the fabric of our community, it's also an integral driver of our economy. There are thousands of students and families throughout the state, the region, and the country trying to decide if it is safe to return to Brookings in a few weeks to either begin or to resume in-person classes. The decisions we make now will determine whether or not they feel safe making the decision to return this fall. If we lift these restrictions now and allow this virus to spread without controls in place, there won't be time to course correct before August. Cities and states that swung the doors open too quickly are now taking steps to reimpose restrictions and are dealing with escalating case counts. I referenced this in an interview last week, but I recently received an email encouraging the council to lift these restrictions. The email noted that we did our job this spring. I have to disagree with that premise. Lifting these restrictions now would be like clocking out for lunch with no plans of returning and finishing this important job. We have to continue the work of mitigating the spread of COVID-19. We have to continue to socially distance. We have to continue to wear masks. We have to position our schools and SDSU to safely reopen this fall. And we have to maintain these restrictions. And I want to reiterate one of those points very explicitly. Wear a mask. If you are pro-economy, you should also be pro-wearing a mask. There is little to no legitimate debate about the effectiveness of masks in slowing the spread of COVID-19. If we want our businesses to reopen at full capacity sooner rather than later, we should all be wearing masks. Our job is not done, so let's put on our masks and finish it together. I'll be voting yes.
Thank you. Other two, do you have any comments?
Mayor Corbett, this is Patty.
Yes.
I won't take any time. I think that Ope and Nick have spoken very eloquently. I will be voting in favor. I hate what this has done to our economy. I hate that we've had to make these decisions, but I feel strongly that they're the responsible decisions to make. So I will be voting yes.
Okay.
And Mayor Corbett, this is Holly, and I would just also say I won't take much time because I know we're on a time crunch, but I agree with the comments that Ope and Nick and Patty have made. I think that one of the duties of the City Council is to help protect the well-being of our community, whether that be the economic well-being or the health of our citizens. And I believe that keeping these restrictions in place will only help both of those things in the long run. So I intend to vote yes as well.
Okay, thank you. And again, great comments, great discussion tonight. There's a lot of questions yet that we need to be looking into so we can make decisions. And this decision tonight's pretty easy for me. I'm going to vote yes on it, and I feel very strongly about this ordinance. So, Jake, would you please call the roll?
Brink?
No.
Corbett?
Yes.
Niemeyer?
Aye.
Tilton Burn?
Aye.
Wendell?
Aye.
Collins?
No.
Bacon?
Aye.
The ordinance is approved. Okay, council, looking ahead, next week's meeting, we don't have a lot of time to talk about future discussions, so July 14th meeting, we'll have a budget workshop at 4 o'clock. Anything else?
Can I just ask a clarifying question? This ordinance now renews these restrictions for the next 60 days, but we can revisit those at any time in that 60-day period, correct?
Correct. As soon as publication happens, it'll be in place for the next 60 days, beginning of September.
Thank you.
Okay, at this time, entertain a motion to adjourn.
So moved.
Second.
We have a motion